Human metapneumovirus, HMPV, is more than just a cold. It's a respiratory virus that can pose serious risks to young children, older adults, and those with weakened immune systems. Understanding its symptoms, transmission, and prevention is essential to safeguarding your health. Stay informed and take action. Let's explore how to stay protected. What is human metapneumovirus? HMPV. Human metapneumovirus, or HMPV, is a respiratory virus that primarily affects the upper respiratory tract, leading to symptoms akin to the common cold. Discovered in 2001, HMPV is a member of the pneumovirus family, closely related to the respiratory syncytial virus, RSV. Infections are more prevalent during winter and early spring. While HMPV often results in mild symptoms, it can cause severe respiratory illnesses such as bronchiolitis or pneumonia, particularly in young children, older adults, and individuals with weakened immune systems. Transmission occurs through direct contact with infected individuals, exposure to respiratory droplets from coughs or sneezes, or touching contaminated surfaces. Just a reminder that this video is strictly for instructional purposes, so if you have any medical concerns, consult your doctor. Signs and symptoms of HMPV infection. Cough. A persistent cough is typical, varying from mild to severe. It may be dry or produce mucus, depending on the individual's response to the infection. Nasal congestion and runny nose. Many individuals experience a stuffy or runny nose, leading to discomfort and difficulty breathing through the nose. Fever. An elevated body temperature often accompanies HMPV infection, ranging from low-grade to higher fevers depending on the severity of the illness. Sore throat. Irritation and pain in the throat can occur, especially during swallowing. Fatigue. General feelings of tiredness and lethargy are common, as the body expends energy to combat the virus. Severe symptoms. Wheezing. A high-pitched whistling sound during breathing indicates narrowed airwaves, often seen in severe infections. Shortness of breath. Dyspnea. Difficulty breathing or a sensation of breathlessness may develop, signaling potential lower respiratory tract involvement. Bronchiolitis. Inflammation of the small airways in the lungs, leading to coughing, wheezing, and difficulty breathing, primarily affecting infants and young children. Pneumonia. In severe cases, HMPV can cause pneumonia, an infection that inflames the air sacs in one or both lungs, which may fill with fluid. At-risk populations. Number 1. Infants and young children. Due to their developing immune systems, they are at higher risk for serious respiratory complications. Number 2. Older adults. Individuals over 65 may experience more severe symptoms due to age-related decline in immune function. Number 3. Immunocompromised individuals. Those with weakened immune systems, whether due to medical conditions or treatments, are at increased risk for severe HMPV infections. Number 4. Individuals with chronic lung diseases. People with conditions like asthma or chronic obstructive pulmonary disease, COPD, may experience exacerbated symptoms when infected with HMPV. Symptom onset and duration. Symptoms typically appear 3 to 6 days after exposure to the virus. For most healthy individuals, the illness is self-limiting, with symptoms resolving within 7 to 10 days. However, in severe cases or among at-risk populations, recovery may take longer, and medical intervention might be necessary. When to seek medical attention. Persistent high fever, a fever that does not subside with over-the-counter medications or lasts more than a few days. Difficulty breathing. Any signs of respiratory distress, including rapid breathing, wheezing, or shortness of breath. Chest pain, discomfort, or pain in the chest area, especially when accompanied by other respiratory symptoms. Bluish lips or face, a sign of inadequate oxygenation requiring immediate medical attention. If you find this content beneficial, kindly like, subscribe, and enable notifications for ongoing nutrition updates. And I'll put some links down below in the video description. Coming back now to preventive measures. Hand hygiene. Regularly wash hands with soap and water for at least 20 seconds. Avoid close contact. Stay away from individuals exhibiting respiratory symptoms. Disinfect surfaces. Clean and disinfect frequently touched objects and surfaces. Respiratory etiquette. Cover your mouth and nose with a tissue or elbow when coughing or sneezing. In severe cases, especially among high-risk groups, hospitalization may be required to provide oxygen therapy or mechanical ventilation. Transmission of HMPV. Human metapneumovirus, HMPV, is a respiratory virus that spreads primarily through close contact with infected individuals. Transmission occurs via respiratory droplets expelled when an infected person coughs or sneezes. These droplets can be inhaled by others nearby, leading to infection. Additionally, the virus can survive on surfaces, touching contaminated objects and then touching the face, especially the mouth, nose, or eyes, can facilitate transmission. Close personal interactions, such as shaking hands or hugging, also contribute to the spread of HMPV. Diagnosis of HMPV. Diagnosing human metapneumovirus, HMPV, involves a combination of clinical evaluation and laboratory testing. Clinicians assess symptoms such as cough, fever, nasal congestion, and shortness of breath, which are common in HMPV infections. However, these symptoms overlap with other respiratory viruses, necessitating specific diagnostic tests for accurate identification. Laboratory confirmation typically employs reverse transcription polymerase chain reaction, RT-PCR, to detect HMPV RNA in respiratory specimens like nasal or throat swabs. This method is highly sensitive and specific, allowing for precise identification of the virus. Alternatively, antigen detection tests can identify viral proteins in respiratory secretions, offering quicker results but with varying sensitivity. In certain cases, viral culture methods may be utilized, though they're less common due to longer turnaround times. It's important to note that while diagnostic tools are available, there is currently no specific antiviral treatment for HMPV. Treatment and management of HMPV. Rest and hydration. Adequate rest and maintaining proper hydration are essential to support the body's immune response during infection. Consuming fluids helps to loosen congestion and prevent dehydration. Over-the-counter medications. Non-prescription medications can be used to manage symptoms. Fever and pain. Antipyretics and analgesics such as acetaminophen or ibuprofen can reduce fever and alleviate body aches. Nasal congestion. Decongestants may relieve nasal stuffiness, while saline nasal sprays can help moisten nasal passages. Cough. Cough suppressants or expectorants can be used to manage coughing, depending on its nature and severity. Severe cases. Oxygen therapy. For patients experiencing significant respiratory distress or low oxygen levels, supplemental oxygen can assist in maintaining adequate oxygenation. Hospitalization. Severe cases, especially in young children, older adults, or immunocompromised individuals, may require hospitalization for close monitoring and advanced supportive care. Recent outbreaks and public health concerns. HMPV has recently seen a surge in cases, particularly in China, where hospitals are experiencing increased admissions, especially among children under 14. Neighboring countries, including Malaysia and India, have also reported rising infections. HMPV typically causes mild respiratory symptoms but can lead to severe illness in vulnerable populations. Health experts emphasize that while the uptick is notable, it aligns with expected seasonal patterns, and the situation is being closely monitored. Comparing HMPV and COVID-19. Key differences and similarities. Human metapneumovirus, HMPV, and COVID-19 are both respiratory viruses that can cause similar symptoms, such as cough, fever, and shortness of breath. However, they differ significantly in several aspects. Transmission and seasonality. HMPV primarily spreads through respiratory droplets and typically peaks during winter and spring, exhibiting a seasonal pattern. In contrast, COVID-19, caused by the SARS-CoV-2 virus, can spread year-round due to evolving variants. Severity and vulnerable populations. While both viruses can lead to severe illness, COVID-19 has a higher potential for severe outcomes across all age groups, including healthy individuals. HMPV generally causes mild to moderate respiratory illnesses, but can be more severe in young children, the elderly, and immunocompromised individuals. Vaccination and treatment. Vaccines and specific antiviral treatments are available for COVID-19, significantly reducing its impact. Currently, there's no vaccine or specific antiviral treatment for HMPV, management focused on supportive care. Public health impact. COVID-19 has led to a global pandemic with substantial morbidity and mortality. Although HMPV is widespread and can cause outbreaks, it hasn't resulted in a pandemic scale event. Natural remedies to support immune health. Number 1, vitamin C. Vitamin C, known for its immune boosting properties, vitamin C is a powerful antioxidant that helps protect cells from damage caused by free radicals. It also supports the production of white blood cells, which are crucial for fighting infections. Foods rich in vitamin C include citrus fruits like oranges, grapefruits, lemons, and limes, as well as strawberries, bell peppers, and broccoli. Number 2, vitamin D. Vitamin D, often called the sunshine vitamin. Vitamin D plays a vital role in regulating the immune response. It helps the body produce antimicrobial peptides that combat pathogens. You can obtain vitamin D through exposure to sunlight, fatty fish like salmon and mackerel, fortified foods such as milk and cereals, and supplements when necessary. Number 3, zinc. This essential mineral supports the development and activation of immune cells. Zinc is particularly important during times of illness as it aids in reducing the duration and severity of symptoms. Zinc-rich foods include shellfish, pumpkin seeds, nuts, and whole grains. Number 4, ginger. This natural remedy has been used for centuries to combat inflammation and infections. Ginger contains compounds like gingerol, which have anti-inflammatory and antioxidant effects. It's particularly effective for soothing sore throats and improving respiratory health. Number 5, turmeric. A staple in traditional medicine, turmeric is packed with curcumin, a compound known for its potent anti-inflammatory and antioxidant properties. Curcumin can help modulate the immune response and reduce the risk of chronic inflammation. Number 6, garlic. Often referred to as nature's antibiotic, garlic contains allicin, a compound that enhances the immune response. Regular consumption of garlic has been shown to reduce the severity and duration of colds and other infections. Number 7, chamomile tea. Known for its calming properties, chamomile tea also has mild anti-inflammatory and antimicrobial effects. Drinking chamomile tea regularly can support immune health by reducing stress, which is known to weaken immunity, and promoting restful sleep, which is essential for overall health. Number 8, echinacea tea. Echinacea is a well-known herb used to reduce the duration and severity of colds. It stimulates the immune system and enhances the production of white blood cells. Regular consumption during cold and flu season can help prevent infections and strengthen your immune defenses. Supporting your immune health naturally is achievable through a combination of a diet rich in vitamins, immune-boosting superfoods, and herbal teas. If you're as passionate about learning about diseases and their impact on health as I am, don't miss out. Tap the screen here to explore the world of diseases and understand how awareness can help you protect and improve your health. Thank you for joining us on this journey to human metapneumovirus, HMPV virus.